just prep your skin a little bit. Your chin right in here. Lower it right there. You got it. Lower your chin. Right in that little spot there. That's it. The wrinkle's 96, which is great. The texture is 60. It's fine. The pores, we're going to work on that. The pores don't actually shrink, but we're going to remove that dead skin to give the appearance of looking smaller, okay? And then, so what I'm going to do is cleanse your skin. So everything we do here is superficial. There's no downtime. Again, it's to exfoliate. Dermaplaning, and that's a handheld blade, and it's going to exfoliate the dead skin, and along comes with that is peach fuzz. Your hair will not grow back any coarser, you know, it's just going to be the same as what you have here, okay? Which is actually a sugar peel. And this is going to help give a nice luminous radiance look to the skin. It's also going to help promote cellular turnover. A little bit on a deeper level, but still staying superficially like we did. It's going to allow the products to penetrate better.
And you said this helps with luminosity of the skin?
Where I lanced, it's very good. With the texture of the skin, nice appearance. And the serums you want to use after you're done cleansing and toning. And then you can apply the rest of the selenium.
It's Queen Buzz, and I am here at 124 Columbia Turnpike in Florham Park, also known as the Peer Group Plastic Surgery Center. I am here with Dr. Lang and Stephanie, and I just witnessed the most miraculous procedure I've ever seen. And Stephanie, can you tell us a little bit about that procedure you just did?
Sure. We did a procedure, what is known as dermaplaning. It's manual exfoliation. It is to specifically remove dead skin very superficially. There's no downtime. And I applied a lactic acid, which is an alpha hydroxy acid, to build moisture. It's more of a humectant, and it's an antibacterial type of acid. And then I applied CO2, which is a dry ice, and it gives a nice luminous effect. It's antibacterial, and it just makes the patient feel really, really nice, along with sunscreen.
Sunscreen is the key.
Yeah.
We integrate skincare with all of our facial procedures, and that gives a tremendous improvement in not only the architecture of the face from the surgical perspective, but also the surface with the skincare. It will also help you to prevent further damage from the sun. And really, the sun damage, the wind damage, that is what causes the premature aging of the skin. And everyone likes a tan, they look great, but if you can protect yourself, that will give you you'll have a more youthful looking complexion for much longer. And you don't think about it when you're in your teens or 20s so much.
Right.
When you get into your 30s, 40s, 50s, you see the damage and you see the aging, and often what we can do is reverse much of that with the proper skin care and with other modalities such as the laser resurfacing or the chemical peel or the dermabrasion. But the key to it all, I think, is sun protection.
Okay. What Dr. Lang just said, spring is here, and then into the summer, the estheticians recommend that we have the patients use a physical block, and that's a coverage of UVA and UVB. It's a broad spectrum.
Okay.
The active ingredients would be titanium or zinc. Those are a very good coverage to use.
Mm-hmm.
The physical block allows that patient to stay in the sun for a longer period of time, and there's better coverage
Okay.
for that period of time as well.
So that'll block the UVA and UVB rays, which are the aging rays of the sun. And the patients will still have some tan to show for it. So you look good, and you've also protected yourself. So I think there's a balance there. It's not that we have to live our lives and have fun, and
Right.
a little bit of color looks great. So
I agree. Now, because I know I always wear like a hat or sunglasses and whatnot. Besides sunscreen, and if we can't see you every day as much as we would like to, and I know you said we can't come in every week, so unfortunately, but between our monthly visits or how often per visitation that you're coming, are there things that you can prep to do to keep up with what you're doing for us?
Yes, you can start with the home regimen at
Okay.
home. Two products I recommend, two topicals, is a Retin-A.
Okay.
This Retin-A, used on a regular basis, will keep the wrinkles away. It really will help promote cellular turnover. And along with that is a hydroquinone for someone who is hyperpigmented, or we also want to suppress those pigmentation
Okay.
areas. And keeping that down, the suppression is using that type of topical on a daily basis. And that's a great combination with the Retin-A.
So it's just keeping up with the daily regimen, like you said.
Certain topicals, and then your cleanser and your sunscreen as well.
And then I have to say, I'm like very excited because when I heard about plastic surgery, I'm like, wait, they're gonna come in here and do some plastic surgery, but it's an actual superficial, as you said. What's the word I'm looking for?
Superficial treatment.
Thank you, treatment. And I think it was an hour that we were in there with Brittany.
About an hour, yeah.
And she walked in, and I took a before picture, and walked out with glowing, like red, I called it the red carpet, queen buzzwords, the red carpet glow.
She looked great, she really did, she glowed.
But I do want to thank you very much for having me here. The Queen Buzz was at the Peer Group. And if you are looking for a warm welcome and a natural look, you can visit their website, www.puregroupnj.com. This is Dr. Lang and Stephanie, and this is only the beginning. Thanks, guys.
Thank you.